Doctors. When did a patient's lie nearly end up killing them? Middle-aged housewife comes to ED with episodes of headache and collapse vacant episodes. Usually early hours of the morning. Has the full workup with CT scans and lumbar punctures several times, always negative. It took several attendances before anyone asked her about recreational drugs. She was an unassuming suburban mum. Turns out she was into cocaine in a big way, leading to reversible cerebral vasoconstriction. No more cocaine equals no more headaches, and no lasting consequences, luckily. I wonder how much of this sort of lying is due to patients being questioned in front of their spouses or family. A patient can't exactly reply yes to "do you do cocaine?" in front of their family, or a teenager can't exactly tell the doctor "I've been having fun with dozens of partners" in front of their parents. Parents are asked to leave the room for teenagers. Those questions are asked and answered confidentially, at least in my experience. I'm one of the unlucky ones with recurrent bouts of RCVS, with no known attributable cause. Daily dosing with verapamil has reduced the frequency to manageable levels and tends to knock the thunderclap headache duration from days down to hours, but it's always there lurking. It's unpleasant. In the past, I've had a couple of go-rounds where I spent several days in a row in the hospital. In one, I was administered the maximum amount of fentanyl allowed 3 days straight. I was having very frank discussions with my wife about getting off the roller coaster permanently during that worst multi-day bout. That level of unpleasant. The daily verapamil has really helped make it manageable. I'm intending to look into asking about trying out nimodipine at my next visit, based on some research I stumbled on last month. Studies are indicating it can reduce the duration and severity even more. It's a very real stroke risk every time it comes back. The arteries in the back of my brain look like a pretty setting of pearls on the MRI during the worst bout. Each pearl was an aneurysm. Incidentally, 2 hours in an MRI machine with a thunderclap headache is beyond torture. Do not recommend it. Anyway, point being, I can't imagine doing anything that would repeatedly bring on a bout of RCVS thunderclap headaches or aneurysms. I can't even fathom the level of addiction that you'd make that trade-off. Had a patient like you once, and we got a back MRI for an unrelated reason, and found a pheochromocytoma. Once that was out, her RCVS and headaches went away. Sorry to hear. Hope the treatment keeps it at bay. String of pearls was indeed what we saw on her MR scan. Not a doctor, but I was in the ER once, separated from another patient by only a thin curtain. It was impossible not to overhear what was going on. She was an elderly woman who had taken an ambulance in due to feeling faint and said she had no other symptoms. Hours are going by, and she gets up to use the washroom a couple of times and makes small talk with her brother, sounding pretty woozy the whole time. Doctors keep checking on her. They draw blood and check her blood pressure. I think it was remarkably low, but they aren't sure why. Cut to several hours later, when a nurse notices there's some blood on the woman's bed. After some back and forth, she finally admits that she had been bleeding profusely from her rectum for weeks. The doctors gave her a hard time, but got her out of there real fast. Yikes, booty blood is never a good sign. What's her status, doctor? I'm afraid it's booty blood. Mother of God. Paramedic here. One common one is when older guys are having chest pain and we want to give them nitroglycerin paste or pills to help the chest pain. One thing that doesn't mix well is nitro and Viagra. It causes a blood pressure drop that can be really dangerous. We always ask and make it really clear that if we give the nitro and they are taking Viagra and similar meds, that they could die. It usually takes 3 or 4 warnings in a row before the guy would admit it. Early on, I made the mistake of trusting a guy after just a couple of mentions of how dangerous it would be. I sprayed the nitro under his tongue, and he said, "Does generic Viagra count?" At one point, his BP wasn't even registering on the box cuff. It was bad. I thought I was going to get screamed at by my doctor, but he just laughed and said it was so common that he wasn't upset, and gave me a couple of ideas on how to make it clear how dangerous it was to the patient. I'm an older man, and I just don't get this line of reasoning. I'd rather be slightly embarrassed. To be honest, I wouldn't even be embarrassed stating I was taking Viagra while talking to a medical professional. And alive than dead, with my dignity intact. Actually, post-mortem would probably list my cause of death as a bad interaction between Viagra and the heart meds, so I wouldn't even have my dignity to show for all my stubbornness. Odds are your dignity would be even more shattered because 1. They know you take Viagra or equivalent, 2, you are so self-conscious about it, you were willing to die. It sucks you have to rely on people giving you the information themselves. I work for a specialist, and luckily the EMR system we use is shared by a lot of other docs in the area. When a patient calls, I've already entered in their phone number, pulled up their chart, and am answering my own questions while they talk to me. Whenever I ask them questions myself without consulting their chart, they either legitimately don't know the answers or they lie. After a year at this job, I basically don't believe anything a patient says beyond, "These are my symptoms and I need an appointment." I never understood lying to the one person who needs to know what all is going on with your body. I don't know, but if there's one thing I learned from all of the murder mysteries I read as a kid, it's people will try and lie and hide all kinds of information, even if it doesn't benefit them to do so. I work in an outpatient surgical centre. Lying to anaesthesia can be really dangerous. I've had a person lie about not taking drugs and then react badly when given the anaesthesia meds because they interacted. Fortunately for that patient, not nearly dying, but I will forever have it ingrained in my head the anaesthetist leaned over their head screaming, "What drugs did you take?" Another that I fortunately haven't seen serious events, but definitely has happened to our providers, and I've seen more mild versions, people eating or drinking before the anaesthesia and then denying it. Lucky for my patients, they have just puked up after waking up, so we know that they had it, but made it okay. The danger is you can puke during sedation and then get it in your lungs, called aspirating, and die from that. Could be really bad, but fortunately I personally haven't seen the worst yet, but I've heard plenty of stories of it. Not a doctor, but my sister's godfather was diabetic. He went to the ER because he had a really bad cold for like 2 weeks. He went in and they asked him if he was a diabetic, and for some reason he said no. Long story short, they gave him something that made his sugar levels go up, and he went into a coma. He died about a month later because his organs shut down. A hypo can give him delirium, which may have caused him to say no. I was just thinking this. I had really low blood sugar once, not diabetic, and couldn't tell you my name, the state I lived in, or anything really. It was weird and scary. When patients lie and say they haven't eaten anything prior to elective surgery when they have. I caught a patient snaffling biscuits that her partner had brought in for her because we are so cruel to deny her food. People can die from aspirating stomach contents during a general anaesthetic. I was in the hospital with what ended up being severe gastritis. They put me on IV fluids almost immediately after seeing numbers. High heart rate, high BP, CBC came back with a ridiculous white blood cell count of 42 when normal is 4 to 11. But they wouldn't let me drink anything in case they needed to do an endoscopy. More blood tests, more waiting, I get admitted. More waiting. By this point, my mouth is parched. My head is stuffed up, so I've been breathing through my mouth this whole time. It ended up being something like 26 hours before I was given ice chips, and 32 before I was finally given water to drink. They just couldn't make up their mind on when they could find the time with the doc to do the endoscopy. The first drink of water after 32 hours is the closest thing to what I can imagine true salvation feels like. If, God forbid, this ever happens to you again, you can ask for mouth swabs to moisten your mouth. My hospital had lemon-flavoured ones. One of my relatives had a bad reaction to amoxicillin as a child. Puffy face, trouble breathing, emergency room visit, bad. Fast forward 15 years, she's off at college and has come down with some sort of infection. She, however, didn't inform the campus health people because, and I quote, "Allergies are caused by a bad diet, and since I'm a vegetarian I shouldn't have them anymore." Yeah, they prescribed her amoxicillin, and if it weren't for her roommate being home to call an ambulance, she'd have been dead. Well, at least that wasn't a lie, just stupid. Darwin may catch up to her. I wasn't the lead on this case, but I was the assist. When I was in dental school, this patient came in and was really hyped up. My buddy asked him if he'd been on any drugs. and the guy just said he had a lot of caffeine. Okay, we move forward. From what my friend told me, his blood pressure was high, but not too high for an elective procedure. Part of the local numbing we give patients has epinephrine in it, and sometimes this gets into the bloodstream with certain types of nerve blocks. Not uncommon. However, If you've snorted a couple of lines of cocaine and then get EPI in your bloodstream, that's no bueno. Ended up calling the ambulance. His BP was so high he was at risk for a stroke. So yeah, even stuff the dentist does can kill you if you lie. Every dentist's office I've been in as an adult has had a poster on the wall in the waiting room warning about this exact same thing. My understanding is meth also has a really serious reaction with dental anesthetic. People, we're medical professionals, not the FBI. Please, for the love of all that is holy, be honest with us. Not a doctor, but an army combat medic. We were in a small firefight, and an ANA soldier was hit in the leg. It was very easy to see the wound because the desert camo doesn't blend in well with blood. The part that almost killed him is he never told us that he was hit in the chest. We asked him and he said only in the leg. I knew he was lying because he was holding his chest too, but I didn't want to make a bad situation even worse, so I didn't say anything. But when we asked him again and he said no, I didn't want him to die, of course, so I pulled his plate carrier off and we did more medical on him. He definitely would have died from that wound. It punctured his lung and he was having trouble breathing. We called for a medevac and he lived, but only with one lung. Never knew it he joined the ANA again, but I assumed he stayed out. A lot of them I get. This one, no way. I guess it is the stress from the combat, because I can see no way how a sane person could believe this lie would somehow help him. I see he might have wanted to stay in combat, but still, it's your chest. There's quite a bit of things you need in there. I can see being so terrified by the situation that the soldier wouldn't want to even admit to himself he'd been hit in the chest, or maybe not even able to. Like when you cut yourself badly and can't even look at it, but a times a million. Your brain does weird to cope in situations of extreme stress sometimes. I work at an STD clinic, so the stuff I deal with isn't usually deadly, or at least not immediately deadly. However, I am constantly surprised by the percentage of patients who test positive and refuse to tell their partners. A guy came in a few years ago who had something relatively simple like gonorrhea, but seemed to have trouble walking. Long story short, a nurse called an ambulance for him and sent him to the ER for a spinal tap. Turns out, an ex-boyfriend refused to tell him about his syphilis diagnosis after they had a rough breakup like 15-20 years earlier. So not only was our guy possibly spreading syphilis unknowingly, he now had untreatable neurosyphilis. He worked with our disease intervention specialists to track down as many partners as they could, but I think he died from related complications like a year after his initial visit. That's just heartbreaking. We had a patient that took her home heart meds religiously, even in the hospital, and we were also administering them to her. She was educated not to take any of her home meds while she was hospitalized since we were giving her the hospital meds. She would sneak and take them. Her blood pressure bottomed out and we would have to bolus her. Security was called and had to remove the meds from her and lock them up. We had another patient request a sleep med. The nurse gave it to her. Later, she found the patient barely arousable and blood pressure dropped, which did not make sense as she was given a low dose of sleep aid. Patient had her purse open on the bed and found a prescription for Ambien. The patient took our sleep aid plus a double dose of her home med Ambien. We always instruct patients on admission not to take their home meds while in hospital. We're not allowed to go through their belongings due to privacy. I don't understand why she would keep taking them in hospital when she was having a bad reaction from the double dosing. Some older people are stubborn, and if their family doctor states they have to take it daily, then by golly, Grams is going to take that yellow pill every morning. My, step-uncle, brother of my stepfather, never met him though, lied about being in pain or sick so he could stay home from school and miss a test. Kept upping the ante so they'd believe him. Apparently his parents were pretty strict and he was terrified to admit he'd lied. Long story short, they took him to the hospital, he was diagnosed with appendicitis, and they straight up cut him open. The test was looking pretty good at that point. I was administering patients in the psychiatric ward. Busy night and I was way behind. An older man with schizoaffective disorder is admitted with a caretaker. A nurse asks them a few questions, including if the patient has taken any medicine and/or narcotics. The caretaker says no. I see the patient 4 hours later. He seems delirious, which often is caused by a somatic problem, including medicine. You know where this is going. He can't maintain eye contact and can only sit in his chair and talk nonsense. He drools and yells every word, but somehow seems very tired. I ask the caretaker if the patient has taken any medication, and she says the patient broke into a medicine room at the institution he lives and just started eating random pills. Apparently this is somewhere around 80 pills, not being more precise, because she did not bother gathering the empty pill boxes. The only information I could get was that he definitely ate over 40 lithium pills, which is just great if you really hate your kidneys. Now, after calling the emergency department to quickly prep and an ambulance with an anesthesiologist for transport, I talked with the caretaker, through my teeth, just slightly angry. Apparently the nurse wouldn't understand because it wasn't his own medicine and she didn't want to make a fuss. I screamed into my pillow that night in pure frustration. I later found out he lived after intensive care and almost lost his kidney function. That caretaker deserved to lose her job, and probably some sort of legal or criminal action. When someone in your care eats pills and you know about it, and then tell a medical professional that they didn't, you are endangering the life of another human being. Don't mess around with that. I agree. I couldn't do anything but call the institution and make a complaint, though. I would guess they have made some kind of standard procedure regarding this kind of problem, but I don't know. It should not be necessary. It should be common sense.